So I think text messages make good vaccine reminders because it allows for healthcare providers to communicate with their patients when they're not right in front of them. And we know of parents who have involved in our studies really feel that it's a way that it shows that the provider is thinking about them and cares about them even when they're not in front of them. So we've shown now in a number of studies in both children, adolescents, and pregnant women that providing text message vaccine reminders does bring them in for vaccination compared to standard of care. So we do find very high satisfaction rates with text message reminders, and interestingly, more traditional forms of reminders like phone and postcard often haven't worked in low-income adolescent or rural populations. But it does seem that text messaging at least works in, we know, now low-income population. So I do think it's a good way of reaching people where reminder recalls haven't worked before. Yeah, so when you send text messages, they have to be 160 characters, and that can be a challenge, especially at first. But then you get very good at being able to say what you want to say, in short characters. And I think it actually ends up being helpful because you're forced to be brief, then we end up using language that's very accessible to patients and their families. I do think that practices will start to use more text messages. I think it's really an excellent way for providers and practices to reach out to their patients. And I've been sort of liking it now to a modern day house call. It's really a way that you can visit their family in their house and give them information that you want them to know and have them come back to you then to get vaccinated.